Me too. Okay. So thank you everyone for joining tonight. Again, tonight's topic is aborting a Sachs fetus. The tshuva is written by Rabbi Eliezer Waldenberg, the Tzitz Eliezer. We saw last week one of his tshuvos, so this will be the last tshuva that we do from the Tzitz Eliezer, but he does have an expertise in medicine and halacha. And this tshuva is, I would say, really, really important because it certainly helps rabbis throughout the world cope with very difficult situations. I'll take a step back. If you ask the average Jew, right, the average somewhat knowledgeable Jew, when is an abortion permitted? The answer that you will almost always get is if the mother's life is in danger. That is when a Jew is allowed to have an abortion. Otherwise, they cannot, right? And it's perched as somewhere in between, right, this Christian idea of absolutely no abortions and what we have in society where, you certainly have a much more permissive attitude towards abortion in society in general. It is absolutely and certainly true that if the mother's life is in danger, you may abort a fetus. That is without question. It is not true that that is the only time that it is possible. It is certainly subject to debate. I think that approach probably is right for the Rambam, for Moshe Feinstein, and for Rabbi Soloveitchik. And that's a formidable trio. I don't mean to certainly denigrate them in any way, shape, or form, but it is not true that that is a unanimous opinion, and I'm not sure that that's even a consensus opinion. So what I'd like to do is take you through the tshuva of the Tzitz Eliezer. Again, it's not going to be, we're not covering the entirety of the topic. I really just want to look at his tshuva. But I will tell you that this is the tshuva that has enabled rabbis to be there for families in ways that they need to be, and to give them the backing to stand up, as it were, against the Rambam and Rav Moshe Feinstein and the Rav. The other thing I'll say in preface before I get to the question is, for whatever reason, this is not something that is talked about in the Jewish community. For fear of judgment, for comfort issues, uncomfortability issues, more and more issues have become now, we are now permitted to talk about. This one has not gotten there yet. I'm not sure, we all know people have children who are homosexuals. That's now, we can talk about that. Couldn't talk about it 20 years ago, but now you can talk about it. Depression, other issues, other mental health issues. There are a lot of issues that we talk about now that we didn't talk about in the Jewish community. This is not one of them. And I would tell you that I think it is, not that it's rampant, but that it is more common than people think. And they're very, very serious questions and issues. So let me give you the question. This question is asked to the Tzitz Eliezer in 1974. That is right. That is the year the question is Tafshin Lamed Hey, and it's written to Rabbi Yehuda Eliezer Waldenberg. And the tshuva begins. He actually includes a long question, which he doesn't always, but it gives you a definition, a description of the disease and some of the challenges, right, of why this is a difficult question to answer. And the question is as follows: can we stop the pregnancy, which is essentially abort a fetus, for a child who has a disease called Tay-Sachs? And they have found out, right, that this fetus has the disease after 3 months. So the woman is past her first trimester, and that becomes an important part of the question because, as we'll see in a moment, but before the first trimester, it is certainly easier. Right? He then describes, right, what is a child with Tay-Sachs going to experience, the life expectancy. And his description is as follows. I'll give you just the, right? In the first year, development essentially ceases. In 1970, right, the brain becomes, not in a pejorative sense, but retarded. That is like the Hebrew word he uses, yoter v'yoter mefager b'hitpatchuto hafizit v'hasichlit ke'echad. Right, the brain becomes, it loses function both physically and mentally. The child becomes blind. It has trouble breathing and hearing. And most children with Tay-Sachs, again, I'm not up on the 2021 current literature. Dr. Kukin can jump in and let me, I don't know if you're up with it and things have changed. But the life expectancy of a Tay-Sachs child is, at that point, was no more than 4 years. So it is no more than 4 years. It is an agonizing and terrible and excruciating experience for the child. And certainly, although not physically, it is a disastrous experience for the parents who are watching their child suffer, knowing that that there is no cure for Tay-Sachs, the child is going to die and going to suffer along the way. Right, as our Rabbi would say, Rachmana litzlan, right? That God should have mercy and pity, and that is not a situation that anyone wants to be in. Right? He then describes that, of course, it is a genetic issue, primarily 91%. He says, with access to Shari Chesed medical staff, that's probably right. 91% of the cases of Tay-Sachs in the world are amongst Ashkenaz Jews. I did actually a quick search beforehand. There's apparently some Cajun group in Louisiana, and a few Amish people who also have a tendency to Tay-Sachs. But the overwhelming majority of genetic carriers for this disease is, as he writes, they are Yehudiyot Ashkenaziot. They are Jewish families who come from Grodno, Savlak, Vilna, Kovna, that are in Poland and Russia. So that's where the Jews come from that carry the gene, right? You do need, each parent has to carry the gene, and then if each parent is a carrier, you have a 25% chance, each child has a 25% chance of developing Tay-Sachs. Right? He writes, there is no cure, there is no treatment, right? You can maybe treat symptoms and deal with some of the pain issues. You cannot stop its progression, and you cannot cure it. The other two important pieces of information that he gives us before he gets to the answer is, can you detect it? So you certainly can detect it in the parents. Right? There's genetic testing. It was that really Tay-Sachs started the panels of genetic testing. It is now like there's a lot of Ashkenaz, like the Ashkenaz genetic testing panel is quite extensive. It started really from Tay-Sachs. There was like 2 or 3. It's now past 50, and it might even be beyond that. But you can see then, depending on which segment of the Orthodox society you live in, you can get tested before you're even ret to a potential partner. Part of the shidduch process, certainly in a much firmer world, is a genetic testing panel to see if you're compatible before the families even think this is a good idea. Listen, Tamar and I both knew that we were not carriers before we got married. It was something we were aware of and certainly we tested for. The last piece of information he gives is that through amniocentesis, you can check to see if the child is going to have Tay-Sachs. And at that point, you could not do the test before 3 months. Right? So it had to be done after the first trimester. With all of that information, he is asked the following 2 questions. Number one, let's say there's no child yet. They're not even married yet. There are 2 carriers for the disease, and they love each other. Right? They want to get married, but they don't want to risk having a Tay-Sachs child. So they will not have a biological family. They'll adopt children, they can foster children, but they'll make a decision not to have biological children in order to avoid what essentially is a game of Russian roulette with your children. Right? If you're both carriers, that is, the chance, 1 in 4 chances is really a very significant chance. It's not less than 1%, it's not 2%, it's 25%. It's really a gamble. So that was question number 1. What do you tell an engaged couple or a couple in love who are both carriers for Tay-Sachs? Number 2, this is the question. Again, this is really the question why I chose the tshuva. I wouldn't have chosen it for the first question, although it's an interesting question. Can you abort this fetus after 3 months? So she's now 4 months pregnant, 5 months pregnant. What's the cutoff? And that is his question. Is that permissible or is it not? And his answer, to the surprise of many, is that they absolutely can abort this fetus. He says they can abort the fetus, and he says up until 7 months. So until this fetus is developed for 7 months, you can abort a Tay-Sachs fetus. The tshuva is written, as I mentioned before, to Dr. His last name is Meir. I don't know what his first name is. He is the head of Sharei Tzedek in Yerushalayim. So that in itself is pretty amazing that the head of a hospital in Yerushalayim is asking one of the great poskim of the 20th century for advice on halachic advice on a medical issue. Why does he say that? That now he could have taken one of 2 tracks. One track is to say, yes, the only time that we permit an abortion is if the mother's life is in danger, and psychological suffering is equivalent to pikuach nefesh. It puts the mother's life in danger because she'll break down. The father, the father too. It's 2021 week, But this is the mother is carrying the child. We'll focus on the mother, It's going to destroy her. It's going to break her, and it'll ruin her life. And therefore, we'll make an equivalency between physical danger to the mother's life and psychological danger to the mother's life. That could be one track. That's not the track that he takes. Now, that I'm not saying that argument is without merit. There is, if you were to take a different case, which he's not addressing, but if you were to take the case of a woman who is, God forbid, raped and now pregnant, and she comes and she wants to abort this fetus because she doesn't want to live her whole life reminded of the attack, looking at her child and remembering her rape is probably, so it's not a stretch to make the argument, but I'm not sure that it's the best argument to make because as great as psychological pain is, maybe it's not pikuach nefesh, number one. And number two, it becomes somewhat subjective. There are different people who will respond differently. And maybe for some it's painful, but it's not pikuach nefesh. So either way, that's actually not the track he takes. And the track that the Tzitz Eliezer takes is to argue you don't need to meet a threshold of pikuach nefesh in order to justify an abortion. That gives him more leeway, and in turn gives us, certainly in the rabbinate, more leeway. And he begins with a fundamental point, which everybody agrees on. The question is, how do they understand it? And he says it is barer upashut. It is clear and simple that in halacha, a Jew who kills a fetus, what's the punishment? Take a guess, anybody. What's the punishment, or what is not the punishment?
Not death.
It is
monetary.
Not death, right?
It's a fine.
Right, there's a fine, right? There's a fine if you hit a woman and she's pregnant, and Torah says there's a fine, but it is not death, right? Now, what's the punishment? And let's not talk practically, but what's the theoretical punishment of if I were to kill a human being, a living human being, I am put to death, right? You look at those two facts, and what does it tell you? He says that this is how he starts the tshuva, so we know where he's going. And he tells us where he's going. It's very clear. taking a human life is murder, and it results in a death penalty. Forget about enforcement. It results, if you take a human life, you are liable for death. If you perform an activity which looks like taking a human life, which resembles taking a human life, but the punishment is not death, and you did it willfully, you did it intentionally, right? Let's get all, it was no mistake, it was no accident, it was nothing. If the punishment is not death, right, then ergo, he says it is not considered murder. By stating that, he is right, that is a 180-degree turn from the Rambam. The Rambam uses language of rodef, that the child is, that we can only kill the child as a danger to the mother because the child is considered a rodef, coming after the mother to kill it. Without that, we would maybe have a problem. That language certainly is much more suggestive of seeing the fetus as a living being and having at least be considered some ancillary sort of murder. The Tzitz Eliezer posits at the beginning of his tshuva, Yisrael eno nerag al ha'ubrin, right, that the Yisrael, a Jew, is not put to death for killing a fetus. Right? Again, nobody should be excited at the prospect of killing a fetus. It's a terrible thing to do. If somebody decides I'm going to go and hit a pregnant woman and see what I can do, so there's a place in hell for them, and it's very bad, but they would not be put to death. Now he says, not only that does he say, but according to many poskim, he says, right, I'll read you the line, milvad da'at yechidit, with the exception of a minority opinion. Sovrim ha-poskim, the poskim believe, she'isur miha yeshna, there is still a prohibition, right? So there is a approach that, hold on, let's sit back in. Right, there is an approach that it is prohibited from the Torah, but just not punishable. There is then another option, which is da'at harbe ma-poskim, she'ha-isur eno ela midarabana, that this is a rabbinic issue, which is pretty, that's like, if we started with you can only take a fetus, abort a fetus if the mother's life is in danger, and then on the other side of the equation we put this is a rabbinic prohibition, we have a lot more latitude. Now, before I go any further, I should say this, we have to separate between qualitative and quantitative, right? Quantitatively, when I say something is a rabbinic prohibition, it seems that all of a sudden it's not a big deal. This is not a standard rabbinic prohibition, because no matter how we categorize it and how we classify it, we are talking about a potential human life. That is an equation changer, right? This should never be something that we take lightly, that we simply say, nah, it's a rabbinic issue, right? That would be a travesty of justice on the other front, because we're not talking about, chicken being meat d'Rabbanan. We are talking about a potential human life, right? And he says, on the one hand, you're not going to be liable for killing a fetus, but on the other hand, can you violate Shabbos to save a fetus? All right, what's the answer to that question? Anyone want to hazard a guess? Can you violate Shabbos to save a fetus?
Sure.
Absolutely, 1,000%. Nobody argues on that. Why? Because this is a potential human life. It has the ability to keep many more Shabbos in the future. So as he is correct in labeling it, according to many, a rabbinic issue, when you read through the tshuvos, right, this is a far cry from a standard rabbinic issue, because the stakes are great, right? The stakes are literally a potential human life. But, right, I'll throw out, let me throw out one more example. Okay, example number one is our Sachs case. Example number two, a victim of a rape. I give you two other examples, right? What about a woman who has an affair and the child's going to be a mamzer? And it's bad for the child. The child's a mamzer. It's embarrassing because God, you had an affair, and now the kid is. That's one question. What about a young woman who goes to college and goes to a party and all of a sudden finds out she's pregnant?
There's no sakana there. I mean, there's a differentiation between somebody who's in danger of the fetus versus somebody who unfortunately was born under unfortunate circumstances.
So I'll be very clear. Yes, but in the case of that, so that again, according to everybody, is fine. But the 4 cases that I gave you, again, the rape case is certainly more traumatic and potential for psychological issues greater than having a child who is a mamzer, I would imagine. But I'm not sure you could argue the Sachs fetus poses no danger to the mother, as far as I understand it. Right? You could go through a regular pregnancy. There's no physical danger to the mother. There's no physical danger to the child in utero. I mean, there's a physical danger and a psychological danger. There's a lot to unpack. And at the end, because it's so horrific, Rabbi Waldenberg gives the okay to abort this fetus. But there is no, I think you'd be hard pressed to say that there's certainly no physical danger to the mother.
Rabbi, is there any
Yes.
component here that has to do with the mother's choice that she's made? In other words, like the college student, not the rape victim, but the college student, or the situation where there's a mamzer. Does that come into play at all? That this was a choice that the mother made?
Not really. It's an interesting question. It's certainly a good question. I think the answer to that is not really, right? Because we're not interested in being punitive, right? I mean, the halacha is not interested in saying, well, you made a mistake and you went to a party and you slept with some guy and now you're pregnant.
It's
So
not
you
a
weren't
matter of
careful
making a
enough.
mistake. It's a matter of making the right choices. And
But in a sense,
the consequences for the wrong choices.
Consequences / punishment, that line is very fine, right? I don't think the halacha should be used in a punitive fashion when we say, well, you should have known better. So I don't think you'll find many people who would allow you to abort a fetus in that case.
Rabbi, I don't understand something. If he's basing his tshuva on the notion that a fetus is not a human being, then any abortion would be permitted. He's not basing it on the trauma to the mother.
No, so that he did not say. Nobody should ever quote him as saying that. He said that there is potentially a Torah prohibition with no punishment or a rabbinic prohibition. He does not say anywhere there is no prohibition. There's a prohibition of damaging. There's a prohibition of wasting seed. There's a prohibition of causing loss of life. There are many prohibitions. Right? There are many potential prohibitions that are thrown around in the tshuvos. They're just not murder. Right? Something can be prohibited without it being murder. But everyone agrees that there's a prohibition. But by lowering it to a non-murder prohibition, he gives us a certain amount of leeway. Right? There has to be, in his words, right, extenuating pain and hurt. I don't think embarrassment is different than extenuating pain. Yes, it's certainly going to be a shanda, right? When little Rachel comes and she's not married and she's noticeably pregnant. That is a shanda. But a shanda is a far cry from a Tay-Sachs child. Right? A Tay-Sachs child is a horrific, you watch your child suffer and die. That's different than my daughter had premarital sex and got pregnant. Right? I think those are that's apples and oranges. And I don't mean to minimize the shanda element. Right? I actually asked, so let's be honest, in every Jewish community, you're going to have pregnant women who are not married. In the firmer communities, they just, go to Switzerland and they go to Israel for a year, and lo and behold, they come back healthy, and somebody has, either a family member takes the baby or they put it up for adoption. Everyone deals with it in their own way. But I don't think you're going to find, you're not going to find a lot of support, at least in the halachic literature, for an abortion because it's a shanta. Because the flip side of the rabbinic issue is this is a potential human life. And not Zahava, not because she made a mistake, but because this is a potential human life, you have to justify it with something more than, oh, this is embarrassing, right? And if you're not in the position to take care of a child, give a child up for adoption. There are people who would love to have a healthy Jewish child to adopt. That is an unbelievable rarity because it doesn't happen very often. So that's how he starts the tshuva. And then he quotes a couple of other sources. One of the mamzer tshuva is actually a tshuva from Rav Yaakov Emden in his Shelas Yavetz, where he actually sort of inclined, but doesn't quite pull the trigger on allowing you to abort a mamzer. That is not a consensus tshuva at all. He was not a practicing rabbi in that sense. That tshuva, we didn't learn that tshuva because that doesn't have nearly the traction that this tshuva has, right? But he quotes Rav Yaakov Emden, who says that there's a great pain and a tsar and a ke'ev gadol. So then you would be allowed to abort the fetus. And the Tzitz Eliezer writes, all right, what greater ke'ev gadol, right? What greater tremendous pain could there be than our case? Right? What other case could you find that could be more hurtful to the parents and the child? He then says a couple of things, and so I'll end, and then I'll take some questions. He says it might be better if the doctor was a woman. Interestingly, because a woman is there's a machlokas, as this has always been, by the way, a mind-baffling thing for me, that a woman who gives birth to children is not necessarily obligated in pru'ervu. So don't ask me to explain that, please. That's a mind-boggling notion to me. I think we should pass like the people who say the woman is, but he says maybe if there's a woman doctor, that would be better. And then let me just, I'll give you the answer to the other question, concluding sentence, and then I'll take questions. Right? And then again, what about the other question? Could we let them get married and not have a family? So that he thinks is a categorical no. He actually thinks that is an absolute no, that they should break up and they should, find a non-genetic carrier for Tay-Sachs, and they should both have families. There, he actually has no room for compassion. He thinks they just, if they're not yet married, they should break it off. They should find somebody else, and they should build families in the Jewish people.
Even today, Rabbi, when you could kind of get around that, with all the medical IVF and all that,
today would be a different story, right?
So this was in 1970.
This was 1974. So I don't know. Certainly, we've come a very, very long way since 1974 reproductive technology. And yes, so if in that case it was an all or nothing proposition. Right? Today, listen, it's still a good idea to get tested. If you get tested early enough, there isn't that much heartbreak. If a couple's already connected and they find out, so now, thankfully, we have other options, although that route is also not without its own challenges and its own, issue. Nobody should think that that's just a simple routine process. You do IVF and everything is fine. You can certainly, right? Genetic selection would be 100% mutter in such a case. But that is also an ordeal. The shots and the cycles and the hormones, that's not necessarily a simple thing. But let me just come back to this tshuva. My sense is, I can't believe that there's a rabbi in any large shul that has not dealt with this issue. That would be for me hard to believe. Again, as I mentioned before, we really don't talk about it. I mean, I certainly have. I can't imagine that there's any rabbi in a large enough shul who has not dealt with this issue. The reason it's not talked about is because it's just not. I mean, it's not, for whatever the reasons are, it's not talked about. But it is present and it is prevalent. And I'll say it again: this tshuva, this without the tzitz Eliezer, I think we would be in a much more difficult place if we were only relying on Rav Yaakov Emden and a handful of other tshuvos. He doesn't have the same clout, certainly as the tzitz Eliezer. And the tzitz Eliezer writes that up until the 7th month. Now, what changes in the 7th month? He says there the fetus is already more fully formed, and it's much more challenging. What he doesn't write is that orally, he has allowed people beyond the 7th month to abort a Tay-Sachs fetus. There's a give and take as to why he didn't put it in the tshuva, but that's really irrelevant. But certainly the word around is, and he does make mention of it, that a lot of the earlier tshuvos don't distinguish between, 3 months or after. The Gemara talks about 40 days, where it's before 40 days, much easier. But they don't distinguish between 3 months, 7 months, right? There's a distinction between 40 days and when the process of birth begins. But this is, again, I'll end with this and then take questions. This is the tshuva that allows rabbis throughout the world to be compassionately lenient in very, very difficult situations. Whether it's Tay-Sachs or another genetic issue, or I think a rape victim or whatever it might be, there are, I think, times that despite the fact that we are dealing with a potential human life, or according to the Rambam, a quasi-human life, there are times of great pain and hurt where a lenient approach is warranted. And without this tshuva, we would have a harder time doing it. So this becomes, although not a popularly well-known tshuva, it is an extremely, extremely important tshuva that really gives us a certain amount of leeway to deal with, as I mentioned, some very difficult circumstances. Now, that is the tshuva, and I'm happy to take any questions on the topic, on the tshuva, or the topic at large.
Rabbi, one thing that strikes me interesting, or that maybe a little unusual, it seems like the focus on whether or not you can do an abortion in all those cases seems to be more focused on the mother or the parents than it does on the fetus or the unborn child.
So that here he talks about both. He does talk about both, but it would certainly would depend on the disease. Here he talks about both. He talks about there is great pain to the child. Right. This is not a life that is worth living is the wrong word, but this is a life that is short and filled with pain. That's certainly part of his equation. The flip side, the other piece of the equation is the parents watching this, horrific pain. Would it be the same if you invented a case where the child had 4 good years and died? I don't know, but that's not the case in front of us. The case in front of us is, it's a Tay-Sachs case, and both of those contribute to, I'm not sure, you could probably get away with either one of them to justify it, right. But he does mention both.
Yeah, I think the first case, the pain and suffering of the parents I can see is much, much greater than in the other 3 cases, where I would think the Shonda, I don't want to look at the child, it reminds me of the rape, much less compelling argument than the first case.
So in terms of the suffering of the child, I think in terms of, I've dealt with, that doesn't matter what I dealt with, but it was not a rape case, I think I would have tremendous compassion in that case. I think that would be, to me, I would not have any issues, with aborting a fetus if the mother wanted it and felt that way, right?
Rabbi?
Yes,
Rabbi? In answer to like Alan, I think that would be an instance of where Judaism is so much different than Christianity.
correct.
In-
Meaning
in that We
Right, if we
do
don't
care
take-
about the mother more.
100%. Meaning, if we don't take the Rambam approach, right, then if we feel that there is enough pain and suffering involved in the equation, whether it be the mother or the child, it could be warranted. Again, the threshold is high, as I mentioned before, because
That's good.
the stakes are serious, and we're talking about a human life. But the threshold does not have to be the mother's life is in danger. That's what the Tzitz Eliezer puts on the map.
Rabbi, can you talk, in the very beginning, you talked about the 3 months as a dividing line. Could you elaborate on that?
In what sense?
So I don't, it was something that you said, sorry.
He
That,
No,
said
so
he said it was less of an issue if it was before.
Oh, I mean, so yes, less than 3 months, he feels it's less than an issue. Really, the dividing line in the Gemara is 40 days.
That's right.
Post-birth?
no, 40 days post.
From conception.
Yeah. Oh, okay.
So the truth is that most people don't, they don't share until after the first trimester. I'm not sure what medically changes, but there is something that is there. But that you have to ask a doctor exactly what changes. But those are the benchmarks of 40 days the Gemara talks about. So if you can catch it really early, you have much more leeway. Actually, like really a lot more leeway. And then, it's easier that the person asking the question actually says, if they knew, with under 3 months, so I wouldn't have to ask the question. But now that's after 3 months, so I have to ask the question. He, in his response sort of says, it's not that big of a factor. He puts out the 7 months as a factor, right? Because it now resembles a human form more. But it seems that push comes to shove, at least in the Tay-Sachs case. Again, I would not extrapolate from that to any other case necessarily. But at least in the Tay-Sachs case, which again is a real, an extreme example of a horrific, not life-threatening kind of a case, he is actually willing to permit it, even a little bit beyond that.
Rabbi, hi.
Yes.
I'm having a hard time with just utilizing, at this point in 2000, almost 22, just using Tay-Sachs. Thank God with our technology, there are so many different unfortunate, really devastating diseases that a fetus.
So let me stop you. I'm not saying that it doesn't apply to any other cases. What I'm saying is we're learning one tshuva tonight. We take half an hour, 40 minutes. We can't, it can't be a discussion of, let me just finish the sentence, please.
Okay.
It can't be a discussion of every genetic disease or every halachic case, which is why, we could spend 3 hours going through all the sources, but I'm trying to keep, to half an hour or 45 minutes. So I certainly do not mean to limit, possible permission to one genetic disease. It happens to be, this is the landmark tshuva. This is the case he's dealing with. And that's why we're talking about Tay-Sachs. So it does not mean to say that there aren't equivalent or even worse genetic diseases. I'm just saying that we have a limited time, and therefore, when I started the class, I kind of made an executive decision to really focus on each tshuva as an individual unit and not as the broader topic, because it becomes, unmanageable from a time perspective.
Okay. That's fair. My issue is with the mother and her emotional being, which I know you kind of alluded to, but it can have such devastating effects, so many different different diseases or whatever. I know we're just sticking to Tay-Sachs, and that's one of the more, that we're all testing, but I'm just talking about now is the emotional aspects, which could be devastating and even life-threatening on other levels now that we know what the mental capacity of whether it's severe postpartum or other issues with this situation.
So again, I don't disagree at all, but I'll say it again. This is the tshuva. This was the topic. If we start to talk about,
Okay.
every other disease, I also, I would caution, right, that any time, Tay-Sachs is a particular example where we know exactly what's going to happen at some level of progression, right? For an issue like postpartum depression, right? No rabbi should make any decision without, speaking to the right mental health professionals involved in that case. I don't think any rabbi on this planet has unless they're also a doctor, in which case, not even just unless they're a mental health professional, in which case maybe they do. But yes, so in that particular case, depending on the acuteness of the depression and all the other factors, in consultation with the mental health professionals who are dealing with that case, you can make a case-by-case determination. There's no question that's true, but the permutations are endless. And again, here is the other advantage of the Tay-Sachs case is I don't actually need. I know the physical symptoms. We know what's going to happen, and sadly, we know the eventual early death of the child. It depends actually a little bit less on, a mental health professional's guidance and opinion. This is a little bit more objective in some of the other cases. But you're certainly right. These questions come in, right? Well, all different types of scenarios, and each scenario certainly has to be dealt with seriously. With again, whether it's understanding the genetic issues, the mental health issues, all of that has to come together before hopefully a responsible and correct decision is reached. So you're certainly right. I just, I'm intentionally narrow, I guess, for time and management's sake.
Okay.
Rabbi, I
Yes.
think your approach to Eliezer was excellent, and I certainly am very well familiar with the mental anguish and suffering of the mother, and the fact that you as a Mardatra can take this and expand a little bit farther to other instances where you can apply it is, to me, very insightful. But just to go back to the case of Tay-Sachs, which is where Eliezer is all about, I've spoken to parents of Tay-Sachs children. It is a devastating effect on them, the mother, the father, the siblings. It is an inevitable death, and as you said, it's a slow, agonizing death for the infant, and they all are dead by the age of 4. So we cannot minimize the tremendous amount of suffering that is seen with these Tay-Sachs infants. So it's just a horrible thing. In fact, when I was in college and I did my work on this in a thesis, we did a screening on campus to see, for whether people want to use the information to choose a spouse or not. But we in fact found that the incidence of Tay-Sachs carriers, the recessive gene, was 1 in 25, which means that 1 out of 625 marriages could have the risk of 2 Tay-Sachs carriers marry. Then there's every conception has a 1 in 4 chance of having a Tay-Sachs child. So it's a real problem. It's a real disease. And as was pointed out earlier, now with IVF and we can test cells before they're implanted, we have new technology and new ways of approaching this, which was not apparent in 1974.
Right.
So one other note I just want to add, the question is, why is the Tay-Sachs gene so prevalent in the Ashkenazi Jewish population? 1 in 25 is a fairly high number for recessive genes. There's a theory that in the immigrants from Eastern Europe, that having the Tay-Sachs gene gave resistance to developing tuberculosis. And since we know that tuberculosis, an X-ray, would prevent you from becoming admitted to this country, there was a selection factor for non-tuberculosis patients, which is thought, it's never been proven to my satisfaction, that there may be a reason why the gene is as prevalent as it is.
No,
Well, that's fascinating.
that doesn't work because the prevalence is the same throughout the world, including people who stayed in Europe, people who went to Italy, Israel. So you can't
Now
use
we're getting
the-
serious. Now we're getting
All
serious.
right.
Fascinating. All right, but it was an interesting theory, certainly, and listen, it's pretty amazing.
Yeah, but
that-
if it was tuberculosis.
Full
then
disclosure, in
further it was
1978,
endemic
Dr.
around the world.
Kugan did his
So
thesis
it would, it's like
on Tay-Sachs,
homosexuality, right?
on Tay-Sachs and this tshuva. But it really is, I can't, again, with this, I think I'll close. But it really is, this tshuva is a lifesaver for rabbis to be able to be confident in a compassionate and lenient approach. So this certainly goes on our list. Next week, we're going to talk about just one tshuva from the Binyan Sion, where he allows Shabbos violators to be counted for minyan, and the revolution that has, literally changed our opinion towards the non-observant to the less observant. It is an absolute paradigm shift. So that's next Tuesday. The Binyan Sion is Rabbi Jacob Ettlinger, 19th century Altoona, Germany. That's also a very important, very, very important tshuva. Thank everyone for their contributions and for joining us, and I wish you a good night.
Thank you, Rabbi.